There has been an enormous surge in medical research progress since the end of World War II, when the American people turned their attention to improvement of the health of every man, woman, and child in the country. This research progress was made possible by the activities of voluntary health agencies, of private individuals, and above all, by increasing appropriations from the federal government. In the whole history of the House of Representatives, no man has done more for the health of the American people than Representative John E. Fogarty. He has done this because of his deep compassion for those who are afflicted and less fortunate than the rest of us. He has been effective because of his truly enormous knowledge of the possibilities of medical research, which he has gained through the long years of study of problems both in the Congress and in private agencies throughout the country. For his achievements, he has been honored by numerous organizations, voluntary health agencies, universities, and colleges throughout the land. His most recent honor has come from Howard University in Washington, D.C.
Your actions on behalf of other persons, especially the less fortunate, are so broad in scope and prolific in degree that it would be impossible to mention more than a few of them here. You were responsible for bills authorizing increased funds for expanding research activity and instructional materials dealing with mentally retarded children. Aware of the distress and confusion resulting from the complexities of today's modern world, you sought and achieved legislation strengthening our community mental health centers, and with Senator Hill, you sponsored the Hill-Fogarty Health for Peace Bill, which resulted in the National Institute of Health and Medical Research.
The vast program of research in all fields of medicine, supported by the federal government, is centered in the National Institutes of Health at Bethesda, Maryland. This is recognized everywhere as the greatest center of medical research in the world. The distinguished director of the National Institutes of Health is Dr. James A. Shannon.
Animals, shops, and the like. New construction down to the left there, that white building, is the National Library of Medicine, that, as you know. Immediately before you is the Division of Biologic Standards and the Dental Institute. Out to the right of the Division of Biologic Standards is this new building that constitutes an extension of activities more particularly required by the development of new viral vaccines. Then as you go further to the right, there are two buildings, one that houses the basic science, or will house the basic science for neurology and mental health, and finally a building for the Cancer Institute to house their studies on cancer chemotherapy and the causation of cancer. These will come into being in about 2 years.
You were a key figure in producing legislation that led to the White House Conference on Aging, and the science of geriatrics has profited significantly as a result.
Medicine and law have been partners for generations in this land of ours. I expect this to continue into more and more areas, such as poverty, which goes hand in hand with disease and disability, and old age, which has outlived the killer diseases of youth, only to fall heir to the chronic diseases in later years, and ignorance, which prevents the delivery of appropriate health services to all who need them. Only then, when all men have the opportunity to achieve and to maintain their highest potentials, may you and I, may we the health professions, and the lawmakers on a local or state or national level rest upon our laurels, secure in the knowledge that we have done our job faithfully and completely.
Congressman Fogarty has made his greatest contribution to health as chairman of the House Subcommittee on Appropriations for Health, Education, and Welfare. During the many years of his activity, he has called large numbers of scientists and doctors to testify before him and his committee, and he has earned their great respect and devotion because of his knowledge and because of his own commitment to the cause of health. In this capacity, too, he works closely with our distinguished new Secretary of Health, Education, and Welfare, Dr. John W. Gardner.
Mr. Chairman, because of your own deep interest in health research, you'll be interested in some of the studies that we're doing right now with respect to these fields. We're particularly interested in the possibilities of the artificial heart, and we're examining the costs and the possible development of this very important research. Another thing we're looking at very hard is the effectiveness of the contract research for the Cancer Institute, which, as you know, holds great possibilities, but perhaps needs some improvement if we're going to make further progress. Still, another thing that probably will interest you is our efforts to do a better job in developing health manpower. We really must, if we're going to meet the aspirations of the American people for health care, bring more young people into the health fields, and this is not just as doctors and nurses, but as sub-professionals, nurses' aides and hospital aides of various sorts. And this will take training programs and all of the kinds of educational preparation. I hope that we will succeed in persuading a great many of our young people in this nation to enter these fields and make this their life work.
Mr. Chairman, Mr. Secretary, as you know, Congressman Fogarty and I have served on this committee these past 14 years since the Department of Health, Education, and Welfare was created. It's a real pleasure to have you before the committee today, and I can assure you of our continued support. The items which you pointed out in the area of the artificial heart, health manpower are indeed important areas for development in this country. In our committee reports during the past few years, we have tried to emphasize these two areas of concern. And I can assure you of our complete cooperation. Members of the minority side of the table as well as the majority side will work together to see that the human resources of this country are adequately protected. You can count on us in this Appropriations Subcommittee as you develop this very much needed program.
The acknowledged leader of rehabilitation activities among the physicians of the country is Dr. Howard A. Rusk. He is equally well known for his effective work in perfecting international programs concerning the health of people throughout the world.
I have known John Fogarty for 25 years. It's been my privilege to have seen him on his continuing great crusades for the physically handicapped, the mentally retarded, for more and better research, for better delivery of health services from the researcher's bench to the bedside of the patient. The world owes John Fogarty a great debt, a debt that we can only pay in the currency of a continuing struggle against poverty and disease. I believe, however, that history will write John Fogarty's greatest contribution in an international language, because he has always been a champion for international health. He's realized that disease knows no barriers, whether they be physical, political, religious, or any other. And I believe that when the final chapter is written, that John Fogarty's great contribution will be Crusader for Health, Crusader for Peace.
Mr. President, our distinguished and able and capable Director General, Dr. Kandau, distinguished colleagues and friends, if you will pardon an immediate personal reference, this is the 7th World Health Assembly I have been privileged to attend as a member of the United States delegation. But at no previous session of the Assembly have I had the particular pleasure which is mine today. The year 1969 will mark the 21st birthday of the World Health Organization, the so-called coming of age year. That same year, by happy coincidence, also will mark the 100th anniversary of the establishment of the Massachusetts Health Department, the first modern health department in the United States of America. The people of the United States, therefore, would welcome warmly the convening of the 22nd World Health Assembly in Boston, Massachusetts.
For your well-known humane interest in children, you have been awarded the National Distinguished Service Medal by Parents Magazine.
And I like to quote John Kennedy because he was my favorite. He said, "Today, the implications of national policy necessarily make politicians of all of us. Today, every person, regardless of his interest in politics, holds office. Every one of us in a position of responsibility, and in the final analysis, the kind of government we get depends upon how we fulfill those responsibilities." Thank you very much.
Recent evidence that you have continued to work arduously to realize your dream of a better world for all men was the presentation to you by the President of the United States in February 1966 of the American Heart Association Heart of the Year Award.
Men cannot live without water. In these days of urban growth, with its crowding and pollution, the problem of maintaining an abundant supply of clean water is increasingly serious. This is especially true in times of drought, such as we've been experiencing recently in New England. Assistant Secretary of Commerce Eugene Foley and Congressman Fogarty have been active in the development of this water system.
Congressman Fogarty, I want to congratulate you on the leadership that you've given to this particular project, which is the largest water system that we will be financing either in fiscal year 66 or fiscal 67. It's going to mean not only a great deal to the health of the residents of Providence, East Providence, and hopefully to the health of more and more citizens of Rhode Island, but also the economic development of this area. Health and economic development, in the modern sense, have a lot in common. You represent the health interests of our people in this country, and of course are known for that. I represent the interests of economic development, but because of the leadership you've shown not only in the case of water and the physical needs of the body and air pollution, we've come to realize that modern industrial development must consider health needs, and here's a good example of it. So I want to congratulate you because what you're doing here, I think, shows the way not only for Providence and Rhode Island, but for the entire area of New England.
One of the most important aspects of public health is the prevention of disease, including disease caused by eating contaminated food. One of the most important facilities designed to prevent disease of this kind is the Northeast Shellfish Sanitation Research Center at Narragansett, Rhode Island.
And it's flushed from agricultural and other lands into the freshwater streams that feed our bays and estuaries. And as these botulism bacteria come down into the coastal area, we have noted that they undergo slight changes in their behavior and in their nature, biochemical nature. And this is rather exciting and new kind of information and may help us to further understand the fate of such bacteria, not only in the marine environment, but in seafoods themselves.
Throughout the world today, we are deeply concerned with the quality of the air that we breathe. Polluted air is linked by medical authorities with many diseases. Air pollution control is an important responsibility which must be shared by governments at federal, state, and local levels. Legislation passed by Congress has been helpful in dealing with air pollution problems, but much remains to be done. The help of knowledgeable and sympathetic legislators will be necessary if we are to recreate and maintain an atmosphere in which our people may live in good health. The family doctor plays an invaluable role in protecting the health of the American people. The president of the American Academy of General Practice, known throughout the country for his leadership, is Dr. Amos Johnson.
Most of us believe that we're going to have to alter the concept that we have of what is adequate medical care for our people if we're going to supply real good care. Now, this concept involves the creation of a new identity in the medical care field, a new type of a physician to supply this care. And basically, this physician will be identified as a family physician. And what we're going to need, it'll be necessary that we have some funds identified by the Congress of the United States to, one, study this program and see if it's feasible, and if so, then we will need a sizable amount of money to put in, say, in 4, 5, or 6 medical schools, a department of general practice under certain very definite rules so that we have 5 or 6 different plans, neither actually approaching the problem in the same manner, and then after 5 or 6 years, we can identify the plan which will be most productive of this person.
This is Block Island, 12 miles off the coast of Rhode Island. On the island, there is only one physician. The winters are long and the summers are short. There are many such isolated communities in the United States. The interest of Mr. Fogarty and his colleagues in Congress is vital to the support of the health needs of people in these areas. The public health nurse and island officials are proud of the new dental clinic in their high school, which Mr. Fogarty helped bring to the island. In the great effort to discover better methods of treatment of disease and means of eradicating and preventing the great causes of death, disability, and misery today, the work of scientists and doctors is not enough. There must be the devoted leadership given by lay people in many walks of life who provide the support that is necessary and also the impetus for far greater progress than would be possible if doctors and scientists had to work alone. In the history of medicine in this country and the development of better health for our people, the name of John E. Fogarty will go down as one of the great contributors to the cause of health in this country.